This is the pediatric part of the non-traumatic abdominal pain protocol. Um, the first part of it is the exact same as the adult one. Um, so again, just make sure you're doing a detailed physical assessment and a good detailed history. Um, the EMT protocol is pretty much the same. Routine patient care. Patient needs to be MPO. Oxygen is needed, and transport in a position of comfort. Advanced EMTs, you should consider an IV access with normal saline or LR. Um, it says RL, that stands for Ringer's lactate, and as opposed to lactated Ringer's, it's the same thing. It's the same term for uh, the same thing. So if you see that, that's what it means. Administer a fluid bolus of 20 milliliters per kilogram if the pain is severe, so greater than a 6 out of 10. Uh, you can administer fentanyl 1 microgram per kilogram, IV, IM, intranasal, or you can do morphine 0.1 milligram per kilogram IV. So I've never done it before, but I've heard other medics talk about it, uh, and it sounds like a pretty good idea to me. So I'll pitch it to you guys. Fentanyl you can give intranasally. So if you have a young kid, they're really scared and they're in a lot of pain, you can give fentanyl intranasally as opposed to trying to stick them and start an IV. While I think you should still start an IV on them, you can give that first dose intranasally. That way, it kind of relieves some of their pain and makes them a little bit more comfortable. Kids, yeah, again, if they say they're in that much pain, then they're in that much pain, and you should treat it. You want to make them as comfortable as they can. That way, you kind of don't scar them and traumatize them by the medical field. Paramedics, make sure you cardiac monitor, and if they're in shock, refer to the pediatric shock protocol.